I think in the end, it's not just about politics or partisanship. It's really about healthcare financing in Malaysia, which is issue number one. And there's a lack of a political will to really turbocharge that forward. Because if you notice, you go to a public hospital in Malaysia, you go through a major operation, the bill which comes back is less than 100 ringgit. You are pregnant and then you're admitted in a public hospital, you stay there for 1 week, the bill comes back is below 100 ringgit. You go to any other places in the world, often it will be tens of thousands of dollars. And in Malaysia, we subsidize healthcare to the maximum. It takes up a substantial portion of our annual budget. But saying that, it also means that in the long term, as Malaysia becomes an aging population, it is a major concern. And that's where you see nurses, doctors demanding for pay rise, for more allowances, for doctors in particular for permanent contracts, so that in the end, they don't just become contract doctors, so that they have more permanent positions, can specialize better. However, we can always make promises that we will give them permanent positions, but if we don't resolve the core issue of healthcare financing, it becomes very hard to resolve this. For an example, and just recently the Minister of Health was having many dialogue sessions with contract doctors, finding a middle ground solution, because the problem is also about the pension associated to it, the lack of funding, because as Malaysia becomes an aging population and the increasing cost of healthcare, all of this are being factored in. So I think that's issue number one, which caused a very big concern. And that's when you see, for an example, during lockdown, Singapore was very quick to take many of our well-trained nurses, right? Because the fact of the matter is, Singapore can pay our nurse the same amount of money in which an expert or specialist would earn in Malaysia, right? So obviously, if you are a nurse and you're given the opportunity, you'll go to Singapore. But whether that is sustainable in the long term, that's obviously a different issue because of cost of living, currency exchange, and everything else. But for doctors in particular, I get very worried. I think Prof. Adiba made a very good statement which states that, in a way, we are subsidizing different countries' healthcare. Because in Malaysia, for you to become a doctor, the government will subsidize almost 500,000, right? Whether it's through scholarships or whether it's through public universities, we subsidize a great extent of our tertiary education, especially when it comes to the field of medicine. And then when they go out, because of the lack of opportunity in Malaysia, they'll end up going to either UK, Ireland, Australia, Singapore. But we've actually trained them to become some of the best in the world, but then they service different countries' healthcare. Do I blame Malaysian doctors? No. I think that's something which a policymaker like me needs to resolve to ensure that they can get a dignified living in Malaysia and a dignified wage, so that the attraction of moving abroad will not necessarily be that influential. But that can only happen again when we really reform healthcare financing. Because I think for them to leave Malaysia, it's not an easy path, right? I mean, the cost of living abroad is much higher. At the same time, their family roots are all here. But then they still make that tough decision to move, which shows that there's a systemic issue which we need to look at. I think it starts with reforming healthcare financing. So first thing first, is either one of two solutions, right? It's either you gravitate away from universal healthcare, which is politically suicidal, or two is you increase the tax net in Malaysia so that we have more income, which will then be used to allocate to healthcare funding. I think the second solution is much easier. However, I think that messaging must be made very clear to fellow Malaysians that when there is an increase in taxation, every single cent is being redirected back to help you and your family live a better life, so that you can get quality healthcare, quality education, like what is happening to some extent today, as I shared. I mean, many people in Malaysia only realize how much we spend on education and healthcare when they actually get the receipt and it's written there, oh, the cost of this operation is let's say 200,000 ringgit, and the Malaysian government has subsidized 180,000 ringgit of the total amount. You realize, oh my god, that's just one person. So I think that's where we need to really delve deep. The other way, obviously, is to use a more private sector-led solution, which I think requires a lot of research on first, because the last thing which you want, Malaysia's great to build is universal healthcare, quality and affordable healthcare. We do not want to move that way to the point that people from underprivileged communities and background are left out. So maybe that's a more targeted kind of subsidy approach. But whether that's viable, I personally am still not convinced, and I have to look at the white paper which the Minister of Health will be presenting in Parliament very soon, and then go deeper into that. But I think the lowest hanging fruit is really to ensure that the Malaysian taxpayers know that when there's an increase in taxation, it is being redirected to deal with the increased cost of healthcare and also education, which I feel very passionate about.
Yeah, the messaging is crucial. Even like huge first world nations like the US are stumbling all over this messaging. Correct. And having trouble, election on election with this very same issue. Yeah. But, I have family in Malaysia as well, and I look at the hospital bills and it blows me away, right?
Yes.
So used to these massive bills out there. I want you to touch a little bit more on the privatization of healthcare in Malaysia and how that fills a gap, but yet it's tricky, right?
Correct.
You can't let that become the gap filler in the long term.
Correct.
Right? Yeah.
So I think that's the interesting part, right? You see today there are a lot more private hospitals than public, which services obviously a different clientele, those who can afford to pay, largely from upper middle income to T20 families. That to some extent takes away some of the burden from government. Above and beyond that, you see Malaysia positioning itself rightfully for medical tourists to come over. We have some of the best of doctors, and a lot of the doctors who work in public hospitals actually during their free time, it's not that they don't work, they actually move to private hospitals to service a unique clientele, and that's where actually a portion of the income comes from. So that's one side of things. But above and beyond that, there's still a large segment of the Malaysian population which does not have private insurance, which in the end is largely reliant on public healthcare. I mean, I personally, as a fellow Malaysian, when I went through my appendicitis or appendix surgery, I went through PPUM in University Malaya, a public hospital. One thing which I realized, treatment is the best. We have some of the best doctors in the world. I mean, I can tell you, it was so good to a point that when I was in the Philippines then, and we initially, that was for the SEA Games, and then I realized that something wrong with my stomach. It was really huge chronic pain. And then when I went to a private hospital, they did everything. They couldn't identify what was the problem. And this is a private hospital. And then they brought me to another place, did all this thing, couldn't identify what the problem was. And then very quickly, I was on a flight back, arrived in Malaysia, brought to a public hospital. The doctor didn't put me through all these fancy machines and everything. Literally, the doctor just did, in 30 seconds, diagnosed me and realized, okay, you definitely need to go to the operation theatre now for a surgery. And only then did he put me through all this machine thing. But he diagnosed it in 30 seconds. While when I'm abroad, even in private hospitals, it took me, they couldn't identify what was the problem. I realized, wow, that's why I realized that in Malaysia, we have some of the best of doctors, best of equipment, facilities. And that's why even when I meet up with doctors who service clients in private hospitals, they tell me they actually get all the experience in public hospitals, and they're also telling me that public hospitals actually have some of the best equipment. But what's the problem? The queue is ridiculously long, right? And at the same time, infrastructure could be better. And that all ties back to public funding. So I appreciate things a lot better. But obviously, I think in Malaysia, we need to come up with a sustainable framework. And that means working together with private hospitals, public hospitals, and a more sustainable healthcare financing solution. The easy way out, obviously, is to ensure that contract doctors get their permanent posts, and secondarily, to ensure that doctors are paid with a dignified wage and are not overstretched and overburdened like how they are today. If you hear the stories from them, and being a young MP, I keep on meeting with many groups of doctors. My peers are also young doctors as well. They're working, my apologies if I'm not using the right word, like animals. They work morning to night time, weekends, really. They are overworked, and then they are underpaid. All right. So I really want to be very careful with my words, but listening to them really opens up my eyes, because if not only are they being underpaid and overworked, but when there's a lack of a permanent post, that creates a lot of uncertainty as well. And then we can want to ask, hey, why do they bother to go abroad? The answer is fairly obvious in front of us. But to talk about increasing wages without dealing with our low tax base, I think you cannot resolve that solution, or potentially looking at a more targeted healthcare subsidy. So there are multiple solutions which we can experiment with, but being a Malaysian and also policymaker, I'll be very careful in how I do it, because again, one of our country's strength is universal healthcare, quality and affordable healthcare. You do not want to take that away. I mean, if you look at United States, despite being a developed country, I mean, a decent portion of their population do not even have any proper health insurance and fall through the cracks of the system. And finally, when they're sick, when they're old, they can't even get the healthcare intervention which they deserve. In Malaysia, I mean, we don't go through that. Right? Yes, there is a queue. It's not the most perfect and ideal of a system, but I'd say it's significantly better than other parts of the world, but it needs a lot of tweaking and improvements, especially when it comes to healthcare financing. So moving forward to deal with brain drain, I think it is an issue of wages, it is an issue of permanent positions, and above and beyond that, it still ties back to the issue of healthcare financing, which is an integral part of our budget.